So welcome to What Does Customer Service in Dentistry Really Mean? Presented by Sandy Balarjan, and we will begin shortly. I'd like to recognize Devin Gillespie, Canadian Territory Sales Manager. So take it away, Devin.
Thank you, Jessica. So as Jessica mentioned, our speaker tonight, Sandy, I have the pleasure of introducing her. Sandy is a leading authority on how to increase the effectiveness of dental business systems. Ms. Balarja is author of 3 textbooks, Dental Office Administration, first and second edition, published by Top Hat, and the Canadian Dental Office Administrator, published by Nelson Canada. She created the first certificate course in dental practice management at the University of Toronto, Faculty of Dentistry. Sandy has lectured at dental faculties across North America and has had several articles published in many different journals including the Journal of the Canadian Dental Association, Oral Health, Spectrum Teamwork, Just for Canadian Dentists, and other publications. As owner-operator of Dental Office Consulting Services, Sandy specializes in dental practice management consulting, hiring, coaching, and training dental teams, implementation of in-office programs, business, and operational plans. Take it away, Sandy.
Thank you so much, Devin. And welcome back, everybody who's been here before to the Dental Practice Management Study Club. Tonight, it's my pleasure to talk about customer service in dentistry and why it's so important. So starting off with, what is customer service? It's what customers expect. And of course, when we're talking about customers, we're really talking about your patients. And it's very important that when we're providing excellent patient service, to keep in mind that it takes dedication, it takes effort, and it takes focus. So those things have to be part of an overall commitment to your patients. So, and we expect it. We rely on customer service. And at the end of this webinar, or the ending of this webinar, what I'll be talking about are what the most common complaints or the common chronic problems that dental patients will ask you. And so being prepared with great answers to tough questions, I think that's really important because patients really want information. That's really the key to customer service. Providing customer service is a significant responsibility, and it's important to have somebody, especially at the front desk, who can provide that type of customer service. You know, the Disney philosophy, I'm sure everyone's heard of Disney, of course, but the Disney philosophy is, you've heard the term go an extra mile. Well, their term is go the extra inch. So do something a little bit special for even one patient today or tomorrow, and it really makes a big difference in their whole concept of your office. So it's important to take care of the people who keep your business in business. That's really the most important thing. So we'll begin with a roadmap to excellence. So it starts with knowing who your customer is and knowing as much about them as you possibly can. So it's very important to understand information about them, ask them probing questions. Probing questions start with things like who, what, where, when, why, and how. So when you ask a probing question, it will allow and elaborate for time for the patient to answer. They'll talk. If you ask questions that prompt a yes or no response, that's exactly what you'll get, and then the conversation ends. So it's very important also, in order to get to know someone, to listen very carefully to what they're telling you or what they're asking you. And this is really a talent, because you have to listen without prejudging. Without prejudging, you know what the next question is, or without prejudging that that they're looking for, you know, some getting you to write off the insurance or something like that, the insurance copayment. So listen very carefully. I had one doctor at a seminar that I did one time, and he said, you know, God gave us 2 ears and 1 mouth, and we should use them in the same proportion. And I thought that was really quite profound. So developing customer loyalty is really what you want to achieve in customer service, as well as not just achieving satisfaction, but you want that you want return business. Any good business will have return business, and that certainly is conducive with dental offices. So what is the definition of a loyal patient? They're consistent on recall and receptive to treatment. That means that they don't miss appointments, they don't miss their continuing care appointments, and that they follow up with the treatment that you have recommended or prescribed for the patient. And most importantly, they would never see another dentist. Some of the feedback I've been getting from offices recently is, if we don't do this, then they're just going to go to the dentist down the street, because there are so many dentists close together. I live in a condo building, and right downstairs in my building, there are 2 dental offices. So within 2 kilometers, which is 1.6 miles in the US, but within 2 kilometers, there are now 15 dental offices. So the thing is that patients have lots of choices. So what makes you stand out from all of those 15 dental offices, and why should a patient choose your dental office? It's all got to do with building a solid foundation of excellence in customer service and doing something different and something special and making people feel good about coming to your in your office. Also, a loyal patient will refer other patients to your practice, and that's really one of the key elements of customer service, is making sure that your patients are happy and that they are willing to refer their friends and family. So how do you determine if a patient is loyal, or all of your patients are loyal? Number one, start reviewing your continuing care list. So see how many of those recalls are you're retaining. In other words, how many patients do you have to call versus how many patients are already pre-booked for their next appointment? So it's really important that loyal patients will reschedule, or they'll schedule for their next appointment as well, not just for their appointment today. And they'll follow up with treatment. Here's a big one. If your case acceptance is below 50%, that means 50% of your patients don't believe they need the work done. Now, this is one of the big challenges in dentistry, is that a large number of patients that you're seeing are asymptomatic. And I usually put a number figure on it. I usually say around 90%, because if a patient's in pain, they're going to want to be in your chair today. If they're not in pain and they're not feeling any symptoms, then they think it can wait. So a normal case acceptance rate should be around between 80 to 90%, because you won't get everyone. It will never be 100%, but it should be. And I've worked with lots of offices that bring it up to 80 to 90%. And it's just a matter of making sure that they have financial arrangements in place, that they understand the need for the treatment, and so on and so forth. So it's very easy to do. I usually get offices to track this using a simple Excel spreadsheet. And I was going to provide you with one. If you want, I can do it at a later time as part of the handout. But I think anybody can do this. On your Excel spreadsheet, you just put the patient's name, what the treatment is. Do you expect assistance from insurance, and when was it booked? And then you can simply add up the column by doing auto sum in Excel, and then you can see what your case acceptance rate is. I always tell my clients that you can actually quadruple your patient base by simply doing an active ask for referrals. Now, you might wonder what that is. An active ask for referrals, as you know, your business depends on referrals, referring new patients to your office, because you have to have a continuing flow of new patients in order to continue growing. But an active ask is, you would think that after the diagnosis and treatment plan, when they come into your office, you've done an effective case presentation that follows through with completion of treatment. That's not the end of your relationship. It's actually the beginning of your relationship, because every single person that comes to your office is attached most likely to an additional 4 people. And your challenge is really to help encourage that patient that you have in the chair to, and I'm not saying ask them to refer 4 people, but if they're attached to 4 people, they're friends and family. And doing an active ask for referrals is so easy. I tell a lot of times I'll get feedback from clients and they'll say, well, I don't really like to ask, it doesn't really sound very good. But all you need to do is say, if the patient is happy with the treatment, say, did you know that we're accepting new patients? Would you like some business cards? That's the active part of the active ask. So that really is effective, because then if the patient has a business card in their hand, they're most likely to use it. A lot of referrals come just from simple conversations between neighbors and friends and family members. When I was working at the University of Toronto, I had to take a GO training, and there were two young men that were actually sitting talking about intraoral cameras. One fellow went to the dentist the day before, and he was talking excitedly about this, they put this camera in, I could see all this stuff. And I thought, wow, that's really exciting that they're getting so excited. And why is that? Because of the fact that patient had experienced something he hadn't experienced before in a dental office. So he had never seen what an intraoral camera looks like, and how it's blown up on a computer screen. He can actually see what a cavity looks like. So it's really important to be as visual as you possibly can. But the most important thing is taking a normal customer service experience and making it transformational. So that's what really transforms that person's thinking, and that's what helps to create loyalty as well. It's an experience that changes what your patient expects when they come to your office. So the other fellow that he was talking to may have gone to his dentist the next time he went to his dentist and say, how come you don't have intraoral cameras? I heard about this from a friend of mine. People remember the unexpected. And I'm going to use an example tonight. I normally have the fish video. You may have heard of fish. And the reason that I show that video is because they have built their culture and their philosophy around these four items that we're going to be talking about in a little more detail. And if you've ever been to the Pike Place market in Seattle, Washington, it's really cool, where they actually throw fish. So they're throwing fish back and forth, and everybody is excited. Everybody is part of this entire culture. Nobody is down or depressed. And what made me think about this is I had a client who asked me to show that video 3 times in his office, and every time we got something different out of it. I can't show it tonight for 2 reasons. One, we don't have the time, and it's on a DVD, so the technology is a little bit different. But anyway, the 4 things and part of their culture and philosophy is to play. That's why they throw the fish. It plays with the customers. People get excited, and this particular client actually went to a convention in Seattle, went to the Pike Place seafood market, and he said, I darn near brought a fish, and I didn't know what I was going to do with it in the hotel. So anyway, the philosophy behind them is play. So making your job more interesting and more fun by actually, kibitzing about or just being very positive, having a very positive attitude, telling jokes now and then. The first dentist I ever worked for, he would joke around so much. I actually had a patient say, is he okay? Like he was, but he was just always upbeat. He was very serious and very excellent clinician, but he was never, he was always upbeat. And, that made our patients so comfortable, and they just relaxed. And he was especially good with children as well. So play with your customer, make their day, be there for the customer, and I'll talk about that as well. And then most importantly, choose your attitude. That was the first office that I had ever managed. And I used to tell the ladies that I work with that, before you come to work, you could have had World War III with the, with leaving the house, and you got stuck in traffic or whatever. Take a deep breath and smile, because when you smile, it releases endorphins in your brain, and also it makes you feel better, and it makes you relax, and it also helps the patients relax. So it's very important that patients don't pick up on tension in your office, because keep in mind that it's a dental office, so they're already a little apprehensive about being put in the supine position, and that is the last position an animal takes before they surrender their throat. So it's very important that it can be intimidating, and then you're leaning over them with instruments and drills and that kind of thing. Make your patient's day. This is a win-win situation, because if you make somebody else feel good, they will feel good, and you'll feel good doing it as well. When patients leave your office, they should leave in a better mood than when they arrived, and make the experience positive and make them feel good about choosing you as a dentist. That's really, really important. When people see that you're having fun and that you're enjoying your job and you're smiling, keep in mind, we're in the smile business. That's what this is all about. Your people at your front desk should be like this lovely lady who is always smiling, and smile at your patients, because it gives them comfort. The other thing too is that, and you instantly connect through smiling. It's been unfortunate that through the pandemic, everybody's had to wear masks, because that really took away a lot of our ability to connect with people. And so it is unfortunate. I realize that in dental offices, you have to wear masks when you're working on patients. But when they arrive at the front desk, just to smile, welcome them to the practice, and say that it's so great to see you today, and you're looking great, you know, that kind of thing. Let the customer in on the fun. So let them be part of it, not feel that they're being laughed at. So they're laughing with you, and just make it much more enjoyable. Be there. That's really the most important thing. So tune your world out, tune the rest of the world out, tune your patient in. So be aware of what they're saying to you without prejudgment, and without jumping to conclusions that you know what they're going to be asking or what they're saying or whatever. Just listen very carefully to what they are saying. So as I say, tune the world out and tune your customer in. Honestly, ask questions, probing questions: who, what, where, when, why, and how. And don't assume that you know the answer, because they may have something totally different in their mind that they want to ask you. So it's very important to be responsive. And as I say, at the end of this webinar, I'll be giving you some recommendations on what you can say to answer tough questions with really great answers, and be prepared for those tough questions. This is something that I thought was really interesting. You know, if the customer is not buying now, they'll buy later. So when you are in a patient consultation, for example, and you're trying to explain the course of treatment or the treatment plan to the patient, don't be too worried if they decide they want to think about it and they're not buying today, because now you've planted the seed. But the key here is for treatment coordinators or for front desk administrators to follow up with that patient, to make sure that it does stay top of mind, because by the time the patient leaves your practice, they've forgotten most of what you've said. So it's very important. And then they get busy, they get in their car and they drive home, and you know, they're thinking about what their next step is for whatever they have to do that day. So they're not thinking necessarily about your about the dental treatment that they need. So it's very important that you have a solid system of follow-up with your patients, that nothing falls between the cracks. And if you have recommended treatment to a patient and you are waiting to, let's say you're waiting for a pre-estimate to come in from an insurance company, that delays the treatment, number one. But it also makes the patient think, well, you know what, I'm not in pain. Because if your patient's in pain, they'll be in your chair today. If your patient's not in pain, and you know as dentists that a lot of things are not necessarily painful, but it's still like a cracked tooth. It could be anything. That it may not necessarily cause symptoms. So it's more important to follow up quickly and consistently, because that helps the patient to understand and realize that the treatment is really needed. That was me in Seattle, and of course that was the first place I went to was the Pike Fish Market, because it was, and they still throw fish. So choose your attitude, and that's something that you do have control of. You may not have control of a lot of things during the day, but you have the control of yourself and being happy. And like I said, take a deep breath and just breathe out and smile. And it makes all the difference in the world. Have a good time at your job. It makes your day go better. It makes everybody happy and everybody feel better about their job. And you'll get a lot fewer dissatisfied patients, but also your staff members too. This will keep your staff members happy as well. And really, it's a simple choice. You just do it. Decide today is going to be a great day, and it's going to be a very positive day. So why does this matter? Why does customer service in dentistry matter? It matters because this is what secures your future in business. As you know, there are dental offices opening all over the place, and lots of multiple practice owners as well. So there are, as I mentioned, there are so many just in my little area that patients have a lot of choices. So remember that gaining patients and keeping them are your only source of revenue generating activities. Everything else generates an expense. You have to pay your staff, you have to pay for dental supplies, and so on and so forth. So the only thing that helps you to increase your revenue and to grow your practice is to get new patients. And new patients have to have a compelling reason to come to your practice. Patient loyalty has much more to do with the relationship than it does the clinical skills of the dentist, because let's face it, unless you are treating another dentist, they don't know, your patients don't know what your clinical skills are. So it's very important to create that loyalty, create that relationship, and to maintain that relationship. Because remember, it's a relationship of trust. So it's voluntary vulnerability. When they get in your chair, they trust you. And when they open their mouth, it's a very vulnerable position, but it's also a position of they're doing it voluntarily. And keep in mind, if you know how much money that you're spending on marketing and advertising, it costs much, much less to keep a customer happy than it does to attract a new one. And you know this by there's television commercials, there's billboards, you name it. They're all very, very expensive. There's a real estate agent in the area that I live in, and his face, I think, is on every single bus in my city. So, and those are very, very expensive. So it's a lot of, he must be very successful. Remember that satisfied customers cause less stress and take up less time. I know that you've heard of the 80-20 rule. So it's the 80% of patients, or the 20% of patients who take up 80% of your time, basically. But the satisfied customers are usually don't take that much time. So what do patients expect when it comes to customer care in dentistry? First and foremost, in any healthcare setting, they expect information. Your customers are informed consumers. And there's also this thing called Dr. Google. You know, they just go on Google and look things up, and sometimes they think that they can self-diagnose. But so in other words, they have access to a lot more information than we had even 10 years ago. So it's very important that they are provided with the information that is necessary and the information that they need. It's extremely important that your staff look businesslike and professional. So remember that your patients, when they are buying into the treatment plan, that they're making an investment. They're making an investment in their health, as well as an investment in the financial investment as well. So your front desk staff, I mean, I've been in different offices, obviously, and it doesn't matter if they wear scrubs at the front desk. The scrubs are usually more for the clinical side. But as long as they are professionally dressed and with that nice big smile on their face, and that they look neat and clean and presentable, that they're treated like individuals, that they use their names, use eye contact, positive body language, and great communication skills. So the important thing is that when you call somebody by name, it's very complimentary. It helps you to know that you care about them and you think of them as an individual, and try to use their name as much as possible when you're talking to them. But also using the right verbiage all the time is really, really important. And it's a key to how to motivate and guide and direct your patients and motivate them to follow through with the treatment. Also, of course, the environment must feel safe, as you most likely have barriers now, the clear barriers at the front desk. And so that helps the patient to know that you are taking safety precautions seriously, and but also to greet them and make them feel comfortable and welcomed at every given moment. Here's a big one too, is respect their time. If you want patients to respect your time, you must respect theirs. I was at an office one time where the young associate dentist would come in, and he would arrive at the very last minute, or sometimes 10 after 9 when his patient is sitting in the chair. And he'd have his coffee in his hand, he would take his time, and the problem is that was recognized by the patients. The patients would say, well, what difference does it make if I'm late, because he's never on time. And oftentimes the patients had to wait long hours to see him, and they would go elsewhere. So it's very important to respect your patient's time as well. Keep your patients informed. I obviously understand that there are unavoidable delays that happen. You could have an emergency that takes a little longer than you expected, or something could happen. These things do happen, but try to keep your patient informed. And this is the advantage of having a really good front desk person who recognizes that you are maybe running behind. I particularly don't care for that term when somebody says the doctor's running behind. I would rather them say, the procedure is taking a little longer than expected, or something like that, rather than the doctor is running behind. That's just my personal preference. I think it sounds more professional. But as long as you keep the patient informed, because patients are already at the office, they're already there, they're more likely to wait. But if say, for example, their appointment is for 10 o'clock and it's now 10:01 and nobody has said anything to them, then they're more likely to be a little bit anxious, and the time seems to go a little bit slower too. So as long as you tell the patient, I usually tell treatment coordinators or front desk administrators, if the doctor is running 10 minutes behind, then say to the patient, I'm sorry, but this procedure has taken a little bit longer. There's been an unexpected event happen, and the doctor will be about 15 minutes. Do you mind waiting? So you've first of all expanded the time a little bit, so you bought some time there for the doctor. But the other thing is, if he or she comes out in 10 minutes and collects that patient, then you become the hero. So it's kind of a win-win situation. Give your patients the option of rescheduling if you can't meet an appointment time. So I'm not saying like 10 minutes or 15 minutes, but if let's say you're running an hour behind, give the patient an option of rescheduling, because they may have other appointments that they need to attend to, and they may have taken time off work for this, or they're coming in on their lunch hour or whatever. So give them the option of rescheduling. So not all dentists like that when I say that, but it's a courtesy to the patient. And chances are 9 times out of 10, they will stay there. They'll stay and say, it's okay, I'll be fine. Then offer them a cup of coffee or some water or something. Be honest when communicating the times, but just embellish a little bit, just to buy the doctor a little bit of time if you know that they're running 10 minutes behind. Never let your patients feel invisible. I can't tell you how many times I've gone into either a retail setting or a medical office, and I realize people at the front desk are busy. They're on the computer, or they're on the phone or whatever. Even if someone is on the phone, it takes 1 second to look up at the patient and wave and say, they can see that you're busy. So the patient will automatically go and sit down. If you don't acknowledge them, then they'll think that you're not seeing them. So they'll wait there, and then they'll get impatient. So it's better to just acknowledge them, because most patients are reasonably patient, and they're usually willing to wait their turn. If they see that you're busy and you wave and just smile at them and just give them the indication you'll just be 1 or 2 minutes, then they'll be fine. They can go and sit down, or they can they can see that you're busy, in other words. But if they feel like you're not even acknowledging them, where you're ignoring them, that's much, much worse. So acknowledge their presence and get to them as fast as you can without compromising your interaction with the current patient who's standing in front of you. I have a client I'm working with, and the former office manager told there was somebody in the first position here and somebody in the second position, and they said the second position should not see the patient out. Everything's on the person who's in the first position. Anyway, long story short, I said, you got to think like a patient. What does the patient expect? They expect, well, that person is sitting there. They may be working on the accounts receivable. It really doesn't matter. But that person can help me if I can see this lady is busy. So it's very important to make sure that your patient doesn't feel invisible. Never end a patient interaction with the word can't. Patients don't care what you can't do. They want to know what you can do. So never end a business interaction with any type of negative response and your inability to act. So the next time that something like this might happen, try this service-oriented phrase, which is, here's what I can do. Okay, so don't say, I can't do that because, the doctor's busy or whatever. Just say, here's what I can do. I can reschedule that appointment for you, or I can make payment arrangements for the patient co-payment, or anything that will help the patient to understand. So don't make promises that you can't deliver. If you tell the patients that I will be calling you in a week to 2 weeks, make sure that you put on the calendar that that call has to be made. Something else I always tell front desk administrators is to make sure, if you have had to move a patient, for example, but this is an office move, so you've moved them for some reason that there's a conflict at the office or for any particular reason, move them once, don't move them twice. So I would mark on that appointment, do not move, because that way I would know that that patient has already been moved once. And because if you keep moving patients around too much, what'll happen is that they won't respect your time anymore and they won't follow through with the appointment. Their chances are you'll lose that appointment altogether. So move them once, don't move them twice. Also, I tell treatment coordinators to tell the patient when they are there, I'm going to follow up with you in 2 weeks. What's the best way to reach you? Can I reach you by telephone, text message, email? What's the best way that I can reach you? And make sure that you put that on a calendar somewhere so you call that patient. So write these things down. You can also put them right in the computer if you like a little checklist every day, and check your list often. Do whatever it takes to make good on the promise that you have made. And I just thought this was cute. Promises are like crying babies in the theater. They should be carried out at once. So is your customer always right? It doesn't make any difference. You need to make them feel as if they're right. Don't make them feel embarrassed, even though they can be sometimes a little embarrassing, but take away that embarrassment, because you'll get a lot more cooperation from them. So even if your customer is wrong, it's your job to help them feel that they're right. And this is what helps to keep them your customers wanting to come back and to keep your business. When you're communicating with patients, communicate with confidence and power. So don't shoot yourself in the foot by allowing insurance companies to control the treatment decisions. I was in an office one time where a doctor went up to the front desk, and this really, the business side is the front desk is your business area. So the clinical and the business should be separated somewhat. There needs to be a handoff done at the front desk. So in other words, the dental assistant or the dentist can say to the patient coordinator, Mary, Mrs. Smith would like to go ahead with the crown. Would you please take care of the arrangements? So I apologize for the phone ringing in the background. So anyway, this particular doctor went up to the front desk and said, well, we won't schedule the treatment until we send in the predetermination, see what your insurance company will cover. And that's That's totally the wrong thing to say. I always tell treatment coordinators, especially, to say this phrase, and I get them to memorize it actually. If you give me your permission, I'll be happy to submit a pre-estimate on your behalf to see what your insurance company might assist you with. Now, that sentence, even though I've written 3 books, I always say it took me 32 years to write, but it's carefully worded because of the fact that it's saying, if you give me your permission, that's telling the patient, this is your insurance benefit. It's not my insurance benefit. I will be happy to send in a pre-estimate on your behalf, so I'll do this for you, to see what your insurance company might assist you with. So it's not saying cover, it's not saying insurance coverage, it's saying assistance. So that helps the patient to understand that it's not 100% coverage in most cases, especially with major restorative treatment. Try to avoid buyer's remorse, because this will happen if the patient has had major treatment done and they're happy with their smile the moment they leave the office. But 24 hours later, they might think, oh, you know, I really need a new transmission to my car or whatever. I should have spent the money on that. So don't allow your patients to suffer that type of buyer's remorse. Contact your patient a little bit later and say, you know, how are you feeling? How's everything going? Has anybody noticed your new and beautiful smile? And make sure that they still continue to feel the good feelings about themselves, because they feel that when they're in your office and when they've had, let's say they've had some cosmetic work done in your chair, and they feel good when they first see the end result. So you can ask them things, and I actually did this with the patient, you know, if your colleagues reacted to the new you. So praise them on their great decision. Remember that customer service is the art of surprise and delight. But I did this with the patient one time, and I said, has anybody commented on the, I think she had veneers done. And she said, yes, and people are asking me if I've been on vacation. I look rested. They think I've lost weight. Like you never know, but that's just the magic of a beautiful smile. The reason I wanted to talk about this was because especially the fish market. Think about this. Those people at the fish market in Seattle can get up at 5 o'clock in the morning to go to a fish market to sell cold fish. There's nothing new about fish, but think about the exciting new things that are happening in dentistry every single day. Before we started the webinar, we were just talking about the iTero scanners, you know, there's different technologies that are improving all the time. There's different techniques, all kinds of exciting things. And really, when you are transforming someone's smile and you are improving their health, you're transforming their life. And they remember that. And when you reach them on an emotional level, it really makes a huge difference. And then they become loyal to you. I was in an office one time where a lady had written to the little thank you card. And I was reading it when I was at the front desk because he had it sitting on the counter. And I said, oh, did you share that with your staff? Because it was so emotionally charged. And she said to the doctor, this lady had lost her husband, and that she felt kind of lost. And now this doctor, he gave her a full mouth makeover, and not gave it to her, he performed it for her. But at the end of it, she said, you know, you've changed my life and given me a reason to smile again. I mean, it was just lovely and emotional. And years ago, there used to be a show on television called Complete Makeover or something like that. And the people that were the most emotional were the ones that had their smiles transformed, because they always wanted nice teeth. And anyway, it creates an emotional reaction. But this is the type of way that there are various ways that you are transforming people's lives. That's something to get excited about. If these people at the fish market can become internationally famous and excited every day to go to work and sell fish, you can be excited about dentistry, because look what you're doing for a living. You are transforming people's lives. Anyway, that's enough of my pulpit. So when problems arise, it's not a perfect world, and you know there always will be problems that arise. You need to answer questions and solve the patient's problems. And because if you do that, they can provide the best referrals. Just one little quick story that I will tell you. I was in an office one time where there were two gentlemen at the front desk, and one was older, one was younger, one was tall, one was short. But anyway, the taller, younger gentleman was yelling at the receptionist at the front desk. She stayed very, very calm and solved that patient's problem. By the time they left, they were both smiling. They thanked the receptionist, and they made their next appointments. So when I went up to her after and I said, what was all that about? And she said they were charged for a missed appointment because it said on the notes on the appointment, it said, patient canceled, short notice, it was a sunny day. And that was all that was put on there. I thought, well, yeah, you would charge a short notice fee if that's what happened. But the truth was the older man was this younger man's father. The older man had cataract surgery and he couldn't go out that day because it was a sunny day. So that little piece of information made all the difference in that customer interaction. And that's what's really important. So that your notes are, having detailed notes are very, very important as well. So research suggests that unhappy customers don't bother to complain. They just won't come back. And now they have lots of choices. There are lots of dental offices around. It takes courage to complain, especially to your dentist, because you don't know necessarily what the clinical reasons of what's happening in your mouth are. But there are studies that suggest that only 4% of your patients will complain. They'll just change dentists. And 96% of patients may never tell you if there's a problem. The same office, another little story, there was one day there were 8 patient transfer requests in one day. And I thought, oh, there's something really, really wrong at this office. So we sent out a survey to the patients. We certainly transferred the records and sent them I'm very sorry to hear you go. You know, if you ever decide to come back, we'll be happy to welcome you back. Would you mind taking a few minutes to fill out the survey? And so the patients that did, the surveys that came back said that we felt like we were being shaken down at the front desk because this woman all she was interested in was the money. Well, certainly that's true. You need to collect the money for the services that you perform. But anyway, the lady was, I think, Eastern European. English was not her first language. So she was the financial coordinator. And apparently at one point, the dentist said to her, imagine as if this was, so I asked her why she was so harsh and severe with patients when collecting money. And she said, because the doctor told me that he would take it from my paycheck. So I spoke to the doctor because first of all, you can't do that. But secondly, I said to her, this is her understanding. And he said, no. What I said to her was, imagine if this was your paycheck, you know, and that's what he was trying to get across to her. But she thought literally that he was going to take it from her paycheck. So that was another experience. So why do customers complain? Maybe you've promised more than you've delivered, or you've offered limited choices, perhaps with having payment arrangements in place, or your customers don't perceive that you care about them. So it's not about necessarily their dental health. It's more about the money aspect. So you've got to be very careful in your communications, or maybe you've prejudged. If your patient leaves your office unhappy, they'll not only lose their loyalty, but they will likely tell another 6 people. I've heard that number being discussed. It could be 11 people, it could be 20 people, but they may tell more people about their experience. And remember, a lot of the advertising and marketing in dentistry is through word of mouth. So learn from the best, but also learn from the worst customer service experiences that you've had at some point. So customer service is really about helping people. Remember the people who also exhibited jerkish behavior, and you don't necessarily want to be on that list if they have a list. Even though you'd like to forget them, they provide you your best lessons because that's what you know what not to do. Make sure that somewhere down the road you don't appear on someone else's list as well. A complaint is a gift. It's very important that if somebody brings something to your attention, you thank them. Thank you for bringing that to my attention. Here's what we can do. Because this is a learning experience. And I also tell my clients to share this at your office meeting or your daily huddle in the morning. Talk about what that customer experience, because remember, you have to think like your customer, you have to think like your patient. And if there's something that you can improve, some service that you can improve, then that's really the key thing. It provides you with an opportunity or to fix the problem, because maybe there is a problem that you're not aware of. As busy dentists, you are taking care of your patients in the operatory. So you may not necessarily know that this person is trying to shake somebody down at the front desk to collect money from them. So most importantly, it helps you to keep your customer. So cherish it, learn from it, and be grateful that you got that, because otherwise, how would you ever have known that that was a problem? When it comes to dissatisfaction, ignorance is definitely not bliss. A gift is a complaint is a gift. So thank the patient for bringing it to your attention. Hear the problem, listen carefully to what they are saying. Apologize for the inconvenience. Now, this is not saying apologize because I did something wrong. It's apologizing for the inconvenience. You shouldn't have been inconvenienced. If you need more information, ask the patient. Know a solution and propose it if you can. If you don't know, then ask someone else. Solve the problem if you can, or find someone who can solve the problem. But always, if you say that you're going to get back to the patient, make sure that you keep that promise. Whoever receives a customer complaint will own it, resolve it, and record it. So it's really important that that you don't say, well, I wasn't even in that day, so that's not, it couldn't be me. Don't take things personally. You have to really think like the customers. They're bringing some really valuable information to your desk. Personalize the service experience by using the customer's name if and when possible, because that also helps to calm them down as well. Acknowledge great customers by anticipating their preferences. If you know what their preferences are, then do something that's going the extra inch for your patient. The special requests and remembering them and fulfilling them. Every employee is responsible for improving their own work environment. And if you have if you have employees who are unhappy in their job or unhappy with their situation in your office, then address it with the individual and resolve it as soon as you possibly can. If there are some things that you can't resolve, then the employee may want to move to another position or move into another office. Another really quick story, I'm realizing that I'm getting close to the end here, but I was at an office where the patient at the employee at the front desk really was not very pleasant, not very happy. So I asked her what she liked best about her job. She said, well, I really don't like dealing with people. I thought, wow, you picked dentistry? It's a people business. But the fact is that she preferred doing things like calling accounts receivable. Well, we put her on accounts receivable, and I'm telling you, they were cleared up like that. She was doing something that she enjoyed doing. She did it really well, and she didn't have to deal with the people. And if she was in a cranky mood and she made some of those calls, then her voice inflection would be a little bit different. So make it right for your patients. That sends a message to your customer. You should not have been inconvenienced when you come to this office, and we're here, we're going to make it up to you. It also increases the likelihood that instead of leaving upset, that they'll actually be satisfied and possibly thank you. And those two gentlemen, that's exactly what happened in that particular case. Customers don't expect you to be perfect, but they do expect you to fix things when they go wrong. So that's really the important thing. Say thank you. It goes a long way. Send thank you cards, thank you letters. Thank you for coming to the office today. Thank you for being such a great patient. I always enjoy your company when you come here. Thank you for waiting. I appreciate your time. Thank you for your referral. Thank you for being you. Good manners goes a long way. Schedule the next appointment that shows them that you care about them and that you want to make sure that they get their preferred time slot. Keep in touch with your patient throughout the year. You may want to send newsletters or birthday cards. You may want to send birthday cards, or you may want to just send them a happy birthday on an email blast, or send them happy birthday by text message. If you have that technology available, then do what you can. You might want to send them an article that's of interest to them, you know, that something that is related to health and oral health. Remember, it can't be too gimmicky or giveaways. Service excellence really draws loyal customers to your office. It establishes pride in your employees and also improves your reputation within the community. And no amount of advertising dollars can create that type of public sentiment. And it saves you money on advertising and promotion. Okay, so the top 10 chronic customer problems with dental offices. That's what I'm going to go through, and along with each of the problems, I'm going to give you some suggested verbiage as well that you can use. So great answers, being prepared with great answers to tough questions. So develop processes for resolving the chronic problems and implement the processes, and also hold your employees accountable for delivering customer service excellence every single day. Be prepared to answer tough questions with great answers. So just in the David Letterman style, we're going to start with number 10. My insurance doesn't pay 100%. The solution is then you can educate your patient about what insurance is and what it isn't. And remember, try not to use the word coverage, use insurance assistance. I will send a pre-estimate on your behalf to see what your insurance company might assist you with. So that's a lot more welcoming and friendly, and it also gives the patient a more accurate view of what you're actually doing. I also put here dental insurance is disappearing because the indemnity plans that exist now are not sustainable. And a lot of companies are moving toward healthcare spending accounts. So that way the patient has a lot more choices, not just to pick dental, but they can have different things like massage therapy, chiropractic, vision care, and that kind of thing. So think about that. If insurance companies decided to drop dental, for example, Delta Dental went to Delta Chiropractic, then all of a sudden they don't have dental insurance anymore. Then how do you handle that patient, or how do you assist that patient? So that's something to think about as well. I can't afford dental care. And you know, I've heard this from many patients before that, well, I've lost my benefits at my workplace and I can't afford the dentistry anymore. And you know, it's funny, my way of thinking is I think that's when you should go to the dentist. That's exactly when you should go to the dentist, because you want preventive care. You want to make sure that you don't end up having a broken tooth or you're in a lot of pain. So that's when you should really follow up with your preventive care. And really, if patients understood how much they're paying into their dental insurance plan and how much value that they're getting out of it, and the insurance companies are getting rich. But if the patient pays out of pocket, they're actually will save money in the long run. Because think about this, I know crowns may be expensive to a patient, but how many times do you place a crown? Once, maybe in 20 years? You know, you don't have that crown replaced every year. So it's not as if it's an annual expense. It's a one-time deal in most cases. I can't afford dental care, so show them the value of prevention. Show them the value of following up with their preventive care, especially if they are strapped for money. Also, let them know that if you identify problems in the early stages, it will require less extensive treatment. And what that means is patients understand the correlation between less extensive means less expensive. So if they are having financial difficulties, then you might want to work out a payment plan with them, but really show them the value of maintaining their dental appointments and their preventive care. There's no sense of urgency. So remember, if patients, if they're asymptomatic, they think, well, they can wait, especially if it's a cleaning or just a cleaning. I prefer to use the term hygiene appointment, a dental hygiene appointment for patients. So tell your patient if there's active disease present, if it's a perio appointment. And remember that dental disease and dental decay needs intervention. It doesn't go away by itself. So if there's a cavity forming or a cavity starting, then it's not going to go away by itself. And I think I've mentioned in previous webinars that one dentist would say to a patient, well, your choices are this. You can choose to fix it before it breaks, or you can wait until it breaks and I can fix it then. And then it may require more extensive treatment. So I thought that was just brilliant. It was so simple, to the point, and most patients would think, well, I'd rather fix it before it breaks. And remember, using intraoral cameras, showing the patient on the computer screen what a cavity looks like, or where the crack in the tooth is, or anything like that. And when they can see the problem, they buy into the solution. So that's really important. Why do I have to pay for an examination? I hear this one a lot. The doctor was only in there for 5 minutes, and why is this costing me, $100 or $200? Say to the patient, this is a little bit more lengthy, but you're wondering what value you gain from the doctor's examination. In a clinical exam, the doctor diagnoses not just tooth decay and gum disease, but he or she looks for signs of potential serious health conditions, bone infections, and oral cancer. It's the most important part of preventive dentistry, which means keeping your health costs, your health and your dental costs affordable. Looking at that way, it's a great investment. I also say to patients, something, Dr. So-and-so is so highly skilled. He's been doing this for a long time, and he or she has been doing this for a very long time. And you know what? They're so adept. They know exactly how to diagnose, and they can diagnose quickly. Isn't that amazing? Because they have so much background and extensive background behind them. So build up, and you're not saying anything that's not true, because that is absolutely true. The doctor is the only person who can diagnose, and you've been trained. You've been very well trained on how to diagnose and different dental conditions. Fear may be expressed. Some people tell you they're fearful, and most people don't. But you can tell if they're fearful in a lot of ways, but they can avoid having dental treatment done because of this fear, and it's something that they don't necessarily share with you. Studies suggest that 70% of people may avoid going to the dentist due to fear of pain. They feel that it's going to be painful, and I know that you've had patients in your chair. You can be 10 feet away from them and they still think that they're experiencing some level of pain. You can say to them, in most cases, today's dentistry is somewhat pain-free or virtually pain-free. We do everything within our office power to make sure it's comfortable for you. And here's what we do at this office. We will put on a little topical anesthetic, and then before the other anesthetic goes in, don't necessarily call it a needle, even though it is. Try not to lie to the patient, or they'll remember and resent you for it, because it's their fear is their reality. And I'm speaking from experience, because as a child I was a dental phobe, and never imagined I'd ever working in dental office or in dentistry, period. And I used to actually get physically sick when I went into a dental office. So if I can overcome my fear, a lot of people can, but it's because I had the right people working on me and the right people talking me through it. And we build the insurance company directly. This is really important to help the patient to understand. Your dental insurance is your benefit. We'll be happy to bill your insurance company electronically, and you'll receive your benefit within just a few days. This is if you're a non-assignment office, and I highly recommend this. We have several payment options for you at this office, and these are what our payment options are at this office. And remember, I said that within the next few years, that option may be taken away, because more and more insurance companies are cutting back. As you know, the cost of dental insurance is getting more expensive, but also the salaries are a lot higher now, and there's a shortage of staff. There's all kinds of reasons. So dental insurance or insurance companies will definitely cut back, and dental benefits are the first ones that are cut back. Giving them lack of options. So according to Consumers Preferences Index, that was an AGD study, 4% of males were never offered payment considerations, and yet if they had, 78% would have accepted the treatment. 30% of females were never offered payment options, yet 68% would have accepted treatment. So if you add 54 plus 30, divide that by 2, that's approximately half case presentations are not accepted due to lack of payment options. So if you provide payment options for either the co-payment or the entire amount of the treatment, then it gives the patient another alternative. And I know we don't have it in Canada anymore, but I know in the US there's also third-party financing that you can look at as well, like through, you know, whatever companies. Number three, I don't want to be sold. It's not selling, it's patient education. And this is why your follow-up is so really important. If you have diagnosed a condition in a patient's mouth and you have set up a treatment plan, you have decided on a treatment plan, you're working with that patient's insurance company as much as possible, and then there's no follow-up. The patient doesn't hear from you in a month or 2 months. And by the way, this is what insurance companies depend on. Then they think that it was, I didn't need the treatment, or, you know, excuse me, then it becomes more of a sales job instead of actual treatment that the patient actually needs. So then they feel that they're being sold a bill of goods, more or less. And so it's very important that the patient doesn't feel like that, that you have followed up because you care about that patient, you care about their health. And that's what your administrative staff need to do as well. Avoiding buyer's remorse, I've already mentioned this, so don't let them suffer remorse or regretting their decision from getting that beautiful work done. Surprise and delight your patient. Remind them of how they felt the day that they had that work completed in your office. So bring back that nice feeling that they had when they were there. Number one, that the doctor and the patient staff don't care about me. They don't call me by name. You know, they don't care if I miss an appointment. I don't get a call back from the office. And so if your patients leave the office without a next appointment scheduled, then they may think that they don't have a problem, number one, or they think that you don't care about them and they can miss that next appointment. It's not important. So if it was important, you'd make sure that the appointment was booked. So that basically is the reason that you want to do that. So remember, in summary, that your patients are your number one priority. Always be attentive to their needs. And we're service professionals, so therefore we make commitments with care and always do what we say we're going to do. We convey professionalism by using verbiage that enhances your customer service experience. And remember, we're in the smile business, so make sure that your staff are smiling as much as they can, even behind the mask. Okay, at this point, I believe that we can, sorry, it took you a couple minutes over, but I think we can open it up for questions.